Yes, obesity is now becoming an epidemic in children as well as in adults. According to the data given by WHO, the incidence of obesity, which was 4% in 1975, has now increased to 20%, which means out of every 100 children, 20 are obese. Childhood obesity can cause many problems which are very common in adults like heart disease, type 2 diabetes. Then it can also cause difficulty in breathing while sleeping, which is known as sleep apnea. Problems in females like polycystic ovarian disease and mental stress due to low self-esteem in the society. There are many factors, the prominent of which is children having very less physical activity because of the lifestyle that has changed. Parents tend to keep their children mostly in homes, that's why they don't go out to play. Also, the diet. Most of the children now are having fast foods like pizzas and burgers. So, this has become rampant, and this has led to the increasing epidemic of childhood obesity all over the world. Proper diet always helps in preventing childhood obesity. The first step starts right at birth, that is at breastfeeding. So the properly breastfed child for the first 6 months will always be less likely to have childhood obesity later in life. Further on, there should be proper introduction of complementary feeds. Also, avoidance of sugary products or processed foods which contain lot of sugar can also help in preventing childhood obesity. After that, it is always helpful to follow the 5-2-1-0 rule. 5 stands for 5 servings of vegetables or fruits that the child has to have in a day instead of the fast food or burgers and pizzas which the child has. 2 stands for the amount of screen time which should be restricted to less than 2 hours. Best is to restrict it less than 1 hour also. 1 stands for the amount of physical activity. At least 1 hour in a day should be spent in some outdoor sport. And 0 stands for zero sweetened or carbonated beverages. So if you follow all this, it is always possible to prevent childhood obesity. For children who are already obese, the 2 things that we can do starts with first is the diet. Again, everything which can be prevented always helps. So whatever the child used to have, like some processed foods or burgers and pizzas, that have to be completely avoided. Absolutely zero. There's no possibility where you can give such diet when your child is already morbidly obese. The second is physical activity. Encourage the child to have as much physical activity, at least minimum of 2 hours every day. The target will always be to reduce about 1 kilogram of weight every month. So, better diet and better nutrition will always lead to a better life. That is what we are trying to give through this video.